If you are a man dealing with erectile dysfunction, urine leakage, or even constant lower back pain, you may think that the problem is somewhere in your prostate, your hormones, or just getting older. But the real reason could be something most of men have never heard of, about the pelvic floor muscles. Now, these muscles are just as important for men as they are for women. They control your bladder and your bowel, they help you to get and keep an erection, and support your core. And when they stop working properly, they can quietly affect almost every part of your life. I'm Dr. Arkady, and today we're going to change that. I will explain what pelvic floor dysfunction really is, how it affects men's health, and most importantly, what you can do to fix it and get your quality of life back. Well, let's start with the basic understanding what the pelvic floor actually is. Most people have never even heard of it, yet this muscle quietly affects almost every part of your daily life. The pelvic floor is a group of muscles, ligaments, and connective tissue that stretches like a supportive hammock from the pubic bone at the front of your pelvis to the tailbone in the back. Even though you don't see them, they are working for you every single day. In men, these muscles perform several very critical jobs. They support your bladder, your bowel, and other internal organs so they stay in the right position and right place. They play a direct role in your sexual function, helping you to get and maintain your erection, as well as control your ejaculation. Now, they also help you to stabilize your spine because they are the deepest layers of your core muscles, so they participate in your strength and your balance. What many people don't realize is that the men and women have nearly identical pelvic floor anatomy. The same muscles like the bulbous spongiosus or ischial cavernosus and levator ani work in both sexes. The key difference is that in men, these muscles also support the prostate and wrap around the urethra. So why do most people still think that the pelvic floor problems is something that only affects women? Well, the answer has more to do with the awareness than the biology. Pregnancy and childbirth, they place an intense pressure on these muscles. So the dysfunction is just more obvious and more commonly diagnosed in women. And as a result, most of the research, treatment, and the public conversation about pelvic floor health have focused on women. But that narrow view has created a huge blind spot. Men are just as vulnerable to pelvic floor dysfunction, and because of so few people talk about it, their symptoms often go undiagnosed for years. The truth is, your pelvic floor is involved in some of the most fundamental functions of your body's activity. When it works well, you're barely noticing it. But when it becomes weak, overactive, or uncoordinated, the effects can rip through the nearly every aspect of your health and quality of life. Understanding how the symptoms work is the first step towards fixing it and towards reclaiming control over your body. Let's talk about just how common pelvic floor problems really are, because numbers might surprise you. Research shows that up to 16% of men experiencing pelvic floor dysfunction. That's about 1 in 6 men. Quite a huge number for a condition that barely even mentioned in men's health conversations. And that's only part of the story. Some studies suggest that as many as 80% of men have some level of pelvic floor dysfunction, even if they don't realize it or report specific symptoms. Among those who have been diagnosed, between 14 to 60% also struggle with erectile dysfunction. Even among athletes, people you may expect to have very strong pelvic floor muscles, pelvic floor dysfunction is surprisingly very common. But here what's even more concerning. Most men don't even know what their pelvic floor is, let alone that they can do something about it. Research shows that 46% of men live with the pelvic floor dysfunction for 1 to 5 years before getting help. That's years of reduced quality of life, often spent thinking these problems are just something they have to live with. Pelvic floor dysfunction doesn't only affect your body, it can also deeply impact your mental health, your relationships, and your confidence. Many men suffer in silence, feeling embarrassed, isolated, and unsure where to turn for help. But the truth is, this widespread and treatable problems, and first step is simply to understand and acknowledge its existence. Well, now that we understand how important the pelvic floor is, let's look at why things go wrong. These muscles can become weak, overactive, or lose proper coordination. And when that happens, the effects ripple through your body. Weak pelvic floor muscles are extremely common, especially as men getting older. Aging naturally leads to gradual loss of muscle mass, as well as elasticity throughout your body. And the pelvic floor is really not an exception. Prosthetic surgery, especially radical prostatectomy, can also weaken and damage these muscles. Chronic constipation is another major cause. Years of straining puts repetitive stress on these pelvic floor muscles and gradually weaken them down. Obesity adds constant downward pressure and weakens the pelvic floor, and chronic coughing from smoking or conditions like COPD does just the same. But even your daily habits can work against you. Heavy lifting, for example, or high impact performance without proper core engagement places an extra strain on the pelvic floor as well. Neurological conditions such as Parkinson's disease, multiple sclerosis, or spinal cord injury can interrupt the nerve signal to those muscles and, of course, imbalance them as well. And perhaps the most common cause of all is something many of us are guilty of: sitting too much. A sedentary lifestyle causes the pelvic floor to weaken, lose muscle tone, and even become disconnected from the brain, a condition often called muscle amnesia. But weakness isn't the only problem. Pelvic floor can also become too tight or overactive. Chronic stresses, anxiety often leads to constant muscle tension throughout the body, including your pelvic floor. Physical injuries or even emotional trauma can trigger a protective tightening response. Poor postures and shallow breathing pattern also change how the core functions and cause certain muscles to overcompensate. Some men develop what we know as high tone dysfunction, where the pelvic floor muscles simply cannot relax. And in conditions like a chronic pelvic pain syndrome or prostatitis, cycle of pain and muscle tension reinforces itself over time and makes it much worse. The bottom line is that the pelvic floor dysfunction is rarely caused just by one thing. It's usually the result of several factors working together, from aging and surgeries to lifestyle habits and emotional stress. The good news is, once we actually understand what is the cause of the problem, we can start targeting it directly and begin the process of recovery. When the pelvic floor isn't working properly, the consequences can affect almost every part of man's life. But one of the most significant is sexual function. Two of the man's pelvic floor muscles, the bulbospongiosus and the ischial cavernosus, are directly involved in erections. These muscles help to trap the blood inside the penis during the arousal and are crucial for achieving and maintaining the rigidity of the penis. When these muscles are weak, poorly coordinated, or over-tightened, they cannot do their job effectively. Many men with pelvic floor dysfunction experiencing the erectile dysfunction. Others deal with premature ejaculation, where they lose the control too quickly, or delayed ejaculation, where they reaching orgasms become almost impossible or very difficult. Some men may feel pain during the intercourse because of the muscle spasm or tension, while others notice decrease in sensation and less pleasure overall. Research consistently shows a strong connection between erectile dysfunction and the pelvic floor weakness, with studies finding that between 20 to 50% of men with pelvic floor problems also struggle with erectile issues. Sexual function is not the only area that's affected. Bladder control is another major issue. Weak or uncoordinated pelvic floor muscles can lead to urinary incontinence, leaking urine during coughing, sneezing, laughing, or just exercising. Some men developed urge incontinence, where they suddenly and intensely need to urinate, or frequency, where they have to go far more than normal. Others feel like their bladder never fully empties, or experience post-voiding dripping, where the urine leaks even after they urinate. Bowel control can suffer as well. Fecal incontinence, or the inability to control bowel movement, is one of the most distressing symptoms men face. Some men also experiencing flatal incontinence, where they cannot control gas, or chronic constipation caused by lack of proper muscle coordination. Others feel like they haven't fully emptied their bowels even after going to the bathroom. Pelvic pain is another widespread and often misunderstood consequences. Many men with pelvic floor dysfunction suffer from chronic pelvic pain syndrome, ongoing pain in the pelvic region that can be both physically and emotionally draining. Chronic prostatitis, or persistent inflammation around the prostate, often overlaps with this condition. In more severe cases, men can experience a pelvic floor organ prolapse, including rectal prolapse, where the tissue pushes out of its normal position. But here's the good news. Pelvic floor dysfunction is highly treatable. But let's be clear, modern pelvic floor physical therapy is not just about doing a few Kegel exercises at home. It's a comprehensive, multidisciplinary approach that combines cutting-edge technology with evidence-based manual therapy techniques. A qualified pelvic floor therapists are trained to do some of the very important things. They train to assess the pelvic floor function internally and externally. They train to identify whether the muscles are weak, overactive, or both. Create an individual treatment plan and address contributing factors like posture, breathing, and core strength. They also train to integrate multiple treatment modalities for an optimal results. Effective pelvic floor physical therapy should incorporate several key modalities. Number one, manual therapy. This is the foundation hands-on techniques performed by a skilled therapist to release myofascial trigger points in the pelvic floor muscles, to improve the tissue mobility and reduce adhesions, to relax hypertensive muscles through internal as well as the external techniques, to restore normal muscle length and tension, and they also addressing the surrounding areas like hips, abdomen, lower back, and other effective pelvic floor muscles. Number two, therapeutic exercise and movement. Now, not just any exercise or any movement, but the very specifically designed movements and exercise that are there to strengthen the weak pelvic floor muscles with a proper coordination. They train muscles to work in a functional pattern, not just in isolation. This exercise also integrates the pelvic floor function with the core stability. They progress through basic awareness to functional activities, including whole body movement pattern that support a pelvic floor health. Number three, specialized breathing techniques. This is very commonly overlooked but extremely critical. Your diaphragm and the pelvic floor muscle have to work together to create an internal pressure. Diaphragmatic breathing exercise coordinate breathing with the pelvic floor function. Proper breathing pattern reduces excessive intra-abdominal pressure. Breath work helps to release tension in overactive pelvic floor. Integrating breathing with movement creates optimal muscle coordination and reduces the stress response that often contributes to a pelvic floor tension altogether. Number four, biofeedback and neural feedback technology. These technologies revolutionize how patients learn to coordinate the pelvic floor. EMG biofeedback sensors detect even minute muscle electrical activity and display it visually, teaching precise muscle control. Neuromuscular reeducation retrains the brain and muscle connection for proper pelvic floor coordination. Real-time visual feedback shows exactly when you are contracting, relaxing, or using compensatory muscles. It has a process tracking, actually qualifies improvements objectively over time. Modern systems allow us to continue training between therapies and sessions in the comfort of your home. Number five, shockwave therapy. This is by far one of the most exciting advances in the pelvic floor treatment. Shockwave therapy uses an acoustic wave to improve the blood flow, enhance the circulation to a pelvic region as well as the erectile tissue, regenerates tissue, stimulates the healing and tissue repair at the cellular level. Shockwave breaks down the scar tissue. It reduces adhesions and fibrosis of the muscle. It reduces pain, particularly positively affecting the chronic pelvic pain syndrome. It also restores the function. Study shows that significant improvement in erectile function and the pelvic pain. Now, research demonstrates that low-intensity extracorporeal shockwave therapy is extremely effective for erectile dysfunction with vascular causes. It's also effective for chronic pelvic pain syndrome, for pelvic floor muscle spasms and trigger points, as well as extremely effective for post-surgical rehabilitation. Number 6, electrical stimulation. It can help patients who cannot initially contract their pelvic muscles. It can re-educate weakened muscles after surgery or injury. It can also reduce pain and muscle spasm, accelerating and strengthening the process. Now, here's why I think the multimodal approach is so crucial. The pelvic floor dysfunction is rarely just about weak or tight muscles. It involves the neural pathways that need to be retrained, the breathing pattern that affects the pressure and the dynamics, the tissue health and the blood flow, pain cycles and nervous system sensitization, whole body movement pattern and posture, even psychological factors like stress and anxiety. A truly comprehensive pelvic floor physical therapy program addresses all of these factors. This is not a one-size-fits-all approach. It's highly individualized based on your specific dysfunction, on your specific symptoms and goals. Research has demonstrated that this comprehensive approach is significantly effective. It's effective for erectile dysfunction. Multiple studies showed substantial improvement in erectile function. It's important in urinary incontinence, particularly after the prostate surgery, with much faster return to continence. It's very important in chronic pain syndrome, significant and lasting reduction in pain and symptoms, premature ejaculation, much better ejaculation control through proper muscle coordination, and of course, post-prostatectomy recovery, significantly faster healing and better outcomes. By the way, in bowel dysfunction, it significantly improves the bowel control and reduces the constipation as well. The key is working with a qualified therapist who understands this comprehensive integration approach and can create a tailored treatment plan just for you to address all your unique needs. Now, I want to touch a little deeper on the biofeedback technology and how it changes the game. One of the most powerful tools in modern pelvic floor rehabilitation is the new innovations in biofeedback and neural feedback technology. But what exactly is it? A modern biofeedback and neural feedback uses the sensors and a computer technology to measure a pelvic floor muscle activity in real time and display this information back to you in visual or audio feedback. Just think of it as seeing your workout on a fitness tracker, but for your pelvic floor muscles. During the biofeedback session, a small sensor is placed near the pelvic floor muscles, either externally, the surface, or internally, like a very small probe with the electrodes. These sensors detect electrical activity, EMG, when the muscles contract or relaxes. The information is displayed on a screen as interactive computer game that you play using your pelvic floor muscles. You can see in real time how well you contracting and relaxing your muscles. Now, this visual feedback helps you to learn proper techniques significantly faster. Research shows that biofeedback significantly improves the treatment outcome. Well, number one, significantly faster learning. Visual feedback helps patients learn correct muscle activity in significantly less time. It also improves the accuracy. Well, many people think they're doing the pelvic floor exercise correctly, but they're not. And biofeed actually shows the truth. What about motivation? Seeing the process on a screen provides a very powerful motivation to continue the therapy. And targeted treatment for hyperactive pelvic floor muscles, the biofeedback teaches proper relaxation, something impossible to see and to feel without it. It also gives you a very quantifiable results. It actually tracks the improvement objectively over the period of time and giving you this feedback. The modern biofeedback has evolved beyond the basic EMG readings. The advanced systems like Pelvic Floor Cure, which is available through braincure.com, I'll leave the information below. It incorporates cutting-edge technology that provides even more precise biofeedback and treatment protocols. This contemporary biofeedback system actually even may include multiple channel sensors for more detailed muscle mapping. It's used at home. The home use capacity so practical between therapy sessions. It also has an app-based platform which guides the exercise and tracking integration with much broader pelvic health programs, and also has a real-time coaching and progress monitoring. In my practice, as well as my colleagues, are reporting that this particular technology is extremely effective in patients with the erectile dysfunction, patients with chronic pelvic pain, because it's helping patients to learn and release overactive painful muscles. For post-surgical rehabilitation, significantly faster recovery after the prostate procedures. The key is that the biofeedback makes the invisible visible, transforming the pelvic floor rehabilitation from guessing game into precise, measurable therapy. Here's the bottom line. The men have the same pelvic floor muscles as women, and they just likely to develop problems when this muscle's weak, tight, or simply stop working properly. If you are dealing with sexual problems, bladder or bowel issues, or ongoing pelvic pain, you are not alone, and you don't have to live this way. Talk to your doctors and ask to refer you to a pelvic floor physical therapist who takes a comprehensive approach. Don't settle for just a quick treatment or basic exercise. With the right treatment, recovery is absolutely possible, and you deserve to feel your best. If you find this information useful, please subscribe so you don't miss any other important videos.